Protecting the most vulnerable, people with weakened immune systems could soon get a booster shot if the FDA approves it. That could come as early as tomorrow. One doctor tells us why you need to look at your list of medications and talk to your doctor now to be ready for that third shot.
I would love to get that booster because I am concerned. One, did I even build up enough immunity of the first two? And then second, if I did, has it worn off?
Since COVID-19 appeared, Angela Michelle has secluded herself in order to stay alive. She has a rare autoimmune disease.
I have a clotting disorder called antiphospholipid syndrome, and that is what caused the stroke that I had in 2016.
Her team of doctors haven't yet told her when she might be able to get the booster shot, if it's approved. Rheumatologist Dr. Kevin Kemp says the booster shot only applies to about 3% of American adults.
We're talking about a group of patients who have organ transplants, who have cancer treatment, or in my facility, it's patients with rheumatoid arthritis or lupus or vasculitis.
He says it's important immunocompromised people take a look at their medications and talk to their doctors about getting the shot. Some medications are known to block or lower the vaccine's response. That's why a booster shot can help.
For example, rituximab is an important one. CellCept is an important one. High-dose prednisone, more than 20 milligrams. There's also some data on a medicine called azathioprine. And there's also a medicine that's pretty common called methotrexate.
A booster shot would bring Michelle peace of mind. She already has other things to worry about.
The most recent testing that they've done, they realized that my pressures are going up and I'm showing signs of heart failure.
Michelle needs a balloon angioplasty surgery soon. The pandemic postponed it last year.
A Johns Hopkins study found people with a weakened immune system are 485 times more likely to end up in the hospital or die from COVID, even if they're vaccinated. The FDA, along with the CDC, monitoring the potential for booster shots. A CDC advisory committee will meet tomorrow to vote on the vaccine boosters, and the CDC could approve it the same day.